What's going on, everyone? Welcome to today's pandemic update for Saturday, May 6th, 2023. I continue to be masking here at home, but I do have some good news to report to you today. There is no more COVID positive case in the household. The person who was positive has tested negative, and as you all know, I have tested negative twice so far. But just out of decided precaution and the fact that masking to me is so simple to do, I'm going to continue masking for a few more days, so you're going to see me masking in these videos for a few more days. If it sounds muffled, I know. I listen back to my videos when I make the chapters in these videos or whatever, make sure I don't make a mistake or something. Yes, I hear myself. I know it sounds muffled, but just bear with me. Just for a couple more days, we're going to be doing these videos masked here in my office. So that's the way it's going to be to maybe about Tuesday. I don't know how much longer, but let's start off here. India reports another 2,961 cases and 17 deaths in the last 24 hours. India cases continue to rapidly decline. But what we're watching is XBB 2.3 is rising in India. At some point, could that reverse the trend and cause another wave to occur before this one completely runs out of gas and flattens back to the really low levels they had? It's too soon to tell, but it's definitely possible. And we don't even know if XBB 1.16 provides immunity for XBB 2.3, and testing there is just so bad, so who knows what's going to happen. Speaking of tests, moving on to this interesting story. Thousands of COVID tests recalled over bacteria risk, FDA warns. So take a look at this here. You can see more than 500,000 home COVID-19 tests from Roche and SD Biosensor should be thrown out immediately, the Food and Drug Administration is warning, citing significant concerns over bacteria that could infect users of the test. The FDA says the recalled pilot COVID at-home test can be identified by the lot numbers on this page. They have a page there. I will link this on Twitter. I believe I did the other day. But I'll also link this article as well. That way, in case you didn't see it, it'll be on Twitter. Alright, moving on to our next story. This is from CNN. This is really interesting. COVID-19 experts say they warned White House about the chance of an Omicron-level event within the next 2 years. But look down below. We'll just read some. We're not going to read it all, but we're just going to read a few excerpts of this. The experts came up with a surprisingly narrow range of possibilities, between 5% and 30%. According to Dr. Eric Topol, founder and director of the Scripps Research Translational Institute, he said the data was shared with him on the phone. He gave his own estimate of 15 to 20%. Most believe that the odds would be somewhere between the neighborhood of 10 to 20%. So I'm asking you a poll question today. If you're watching this video, if you so should choose, put a comment down below. What do you think the percentage is? I'm curious to know what your opinion is. I mean, I think it's definitely possible we could see another Omicron variant, and we know it could happen at any given time. Would I put it over 50%? I don't know what percentage I would actually put it at, but I definitely think it's in the realm of possibilities that could happen any given time down the line. Moving on to our next story here. Lizzo is calling out sick in Montreal. Now, we have two different sources we're going to use for this one. First one says, Lizzo is scheduled to take the stage on Saturday night at the XL Center in Hartford, Connecticut at press time. The show for Saturday night is still go, but back on Thursday, Lizzo was forced to cancel her performance in Montreal while battling an illness. So let's go on to another story. Here we go. Here's another story on Lizzo cancels show after falling sick with the flu. Now, did she actually test positive for the flu? Or is it really COVID? And the reason why we question that is we have seen so many celebrity cases in the past where you get a case and they're saying, oh, it's this or that. And then about a couple days later, they release an update. Oh, by the way, they tested positive for COVID. It's COVID, not whatever else they diagnosed them. So it's something we'll have to keep watching. We'll look to see if there's an update. As for, speaking of updates, we do not have an update today out of Iowa. I wish we would have an update from that university outbreak. Remember Drake University? I'm not seeing any update out of that. I would like to know if the cases have gone higher. And if I do see anything, of course, I will tweet it out the second I see it. Moving on to this. This really kind of gets under my skin. This is Tedros. This is, the director of the World Health Organization. He's the one who's in charge of it. And he puts here, thank you to the incredible people who I have the privilege to call my colleagues for more than 3 years. The people of WHO, World Health Organization, have labored day and night under intense pressure. Blah, 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 blah. Don't need to read anymore. This is all you need to see. You know darn well COVID is still out there. You know darn well it's still disabling. And, well, there's still deaths each week. Just the previous week, it was, near 1,400 deaths? Here they are like a bunch of circus clowns, gathered together, not one mask in sight, and these are supposed to be members of a highly reputable health organization? The World Health Organization? Their reputation's clearly going out the window here. They don't have any mask on. And for those who are watching this, you may want to subscribe down below to my channel. I'm going to be having another video this evening in relation to masking, because there's something else going on in the masking world of this pandemic that's getting a lot of people upset, and we're going to talk about that this evening. It has to do with masking in healthcare. Speaking of healthcare, here's why that's important, and we'll probably add this again tonight in that video. Hospital-acquired infections. Look at this. Hospital-acquired infections are skyrocketing right now. It's absolutely ridiculous why masking would end in healthcare, but we won't spend too much time on this, because again, we are going to showcase this tonight. Alright, remember yesterday we said raise your hand, or hit like if you think COVID is still a global health emergency-pandemic, and, well, that's now up to 2,774 likes, and that's with Elon Musk's Twitter suppressing the word COVID. In case you didn't know, there's now a special way you have to tweet out the word COVID. You can't spell it out that way. You have to do COV1D or D or something like that. A lot of people are doing that, and it's getting viewed more times. So, very interesting that that's the way things work now. We have nothing for today in COVID history. And moving on to wastewater, as you know now, wastewater is now flat to slightly dropping again across all 4 regions. Stay tuned for a wastewater update video tomorrow. Here's the national map of the CDC. Not much to show you here. Again, I will do an actual dedicated video for this tomorrow. Like I like to do it every week, whether we get enough stations or not. I mean, there's plenty of wastewater sites. We can make something out of it. Here's the transmission map for this week. 550 counties are in high transmission. 354 are in substantial. 1,437 are in moderate. And 775 are in low transmission. Taking a look at the latest variant, XBB.1.5 still rules the roost at 66.9%, then XBB.1.16 at 12.5%, XBB.1.91 at 9.4%, XBB.1.92 at 3.7%, XBB.2.3 at 2.7%, and XBB.1.51 at 2.4%, and FD.2 at 1.6%. Moving on to BNO, we don't have anything to report on from them today. New Jersey, they're supposed to update Monday through Friday. Guess what? I'm not complaining about this. They've updated 2 Saturdays in a row now. 182 new cases added, 64 new probable cases added, and no deaths added. So that's good news on deaths. Let's take a look here at their variant proportion. And it looks like, no, it's not going to work. One of these days we're going to check that out. They have a variant tab there. It's the first time I'm actually noticing that. Hospitalizations. 172 people are hospitalized, and 10 people are in a ventilator and in the ICU. The number today is at 22. Alright, taking a look at Pennsylvania. And I can protest to this. Here's the EMS calls for Philadelphia County. 775 EMS incidents. Yes, that's an accurate number. It was really, last night was really busy here in Philadelphia. I live right near a hospital. I was hearing ambulances going all night long, so I'm assuming, because I've heard ambulances this morning too, I'm assuming Saturday's number is going to be relatively similar, or maybe slightly lower, or relatively similar, maybe higher. I don't know. But I think today's number, when we have reported on it tomorrow, I think it's also going to be high, because I've been hearing a lot of ambulances. But again, that doesn't justify for the entire city, so who knows. But 775 incidents in Philadelphia County yesterday. All right, the only hospital in Center County, Pennsylvania, has just 2 people hospitalized. This will not update again until Monday, so we're not going to show it to you again until Monday. But the incidents in Philadelphia County, they post them stats 7 days a week. God bless them for doing that. All right, New York State also does not update on the weekends. 520 new cases yesterday. This report, 1.7% positivity. The 7-day average is 1.5%. The hospital admissions, this is something I want to show you real quickly. Take a look at the admissions in New York City itself. New York City hospital admissions, look here. They were starting to rise. Now they're trying to drop a little bit again. And there's really no sense of direction in them. It's just bouncing off the bottom. You know when you throw a fishing line in the water with a weight on it and you hit the bottom? And say you're in a boat and you hit the bottom and it's dragging? That's pretty much what's happening with the New York State right now. They're not dropping anymore with the admissions. The hospitalizations themselves, ever so slightly dropping. But if you look here at the last 2 weeks, it's more so bouncing off the bottom. All right, taking a look at some international data. And you can see here the worldwide cases are down 20%. Deaths are down 35%. It's not as big as a decrease now in worldwide cases. And that's because there are some countries that are rising. South Korea is now up 21% on cases, down 25% on deaths. Japan, down, we'll just call it close to 1% down, 19% down on deaths. And France is down 24% on cases, 4% on deaths. Russia's down 29% on cases, 3% on deaths. Australia, cases are down 1%, deaths are up 17%. Coming down here to Indonesia, cases are up 58%, and deaths are up a whopping 66%, so that's not good. Then coming down here to Romania, cases are down 49%, and deaths are down 9%. Alrighty, that does it for today's pandemic update. We'll have another pandemic update again tomorrow, but pay attention to my channel for this evening. I may have a special video on masking in the healthcare setting. There is a lot of buzz going on about that. So a couple of things you saw on here earlier, we'll bring them up again in that video, plus a few other things that have been really buzzing people on Twitter. I mean, there's been a big outpour for masking to continue in healthcare. So we'll talk about that later today. Until I see you all again next time, you need to do 3 things. Stay safe and test negative. Hit the like button if you like this video, and hit the subscribe button if you want to see more content like this. Thanks for watching. See you all again next time.